Today we have Dr. Andrew Klein, a chiropractor from Dodge Center, joining us to tell us about his career. Welcome, Dr. Klein.
Thank you for having me.
Yes, thank you. How long have you been a chiropractor?
About 15 years. I've been in Dodge Center for 14 years, and I was in Minneapolis for a year before that.
What made you move to Dodge Center, of all places?
The clinic I worked at, I was an associate doctor, and to be honest, things weren't jiving between me and the owning doctor that well. So the office in Dodge Center came up for sale, and I thought that it would be a good time to make a change. So that's what I did.
Oh, okay. So it wasn't like you had grown up around the area or anything and wanted to move back.
No, I grew up in Southwest Iowa, and my wife grew up in Northwest Minnesota. So it's kind of almost in the middle between the two.
Yeah.
So yeah, we didn't have any ties here. The closest family we have is over in New Ulm. So
Okay.
not that close by.
Yeah. So tell me the ins and outs of chiropractic. I mean, I would assume some have been there, but for those that haven't, and especially those that are interested in that career field, what is it they need to know about chiropractic?
So chiropractic is essentially healthcare primarily focused on physical structure, um, historically mostly of the spine, but we work on arms, legs, jaws, ears, everything else too. So most of the people that I see they have an injury or they've got a chronic problem, headaches or something that they're dealing with that we're trying to help them out with. I do a fair bit of nutrition and exercise, advice and counseling and things like that. I'm pretty well versed in nutrition and exercise. And to be honest, if people exercised a lot and ate right, wouldn't be a lot of problems in life. But so that's kind of what chiropractic is really all about: treating health ailments without drugs or surgery would be the historical sort of definition.
Okay. And technical skills that would be used. I'm just thinking about my chiropractor. He has kind of a X-ray type machine that he does down my spine sometimes to show where my alignment is out. What kind of tools would you be using, or a normal chiropractor on an average day be using?
Typically, honestly, just our hands. There is diagnostic equipment like that item that you described. But we use, the same sort of diagnostic things that you'd find in a medical doctor's office as well: a reflex hammer and a blood pressure cuff and that kind of stuff. And using those things to determine what we need to do to help a patient. So most of the time, or all of the time, when a new patient comes into the office, they're going to get at least a brief physical exam. If they are able to come in and tell me exactly how they hurt themselves or something, it's a little bit quicker. But if they're not quite sure, we have to check out and see what's going on. So as far as technical skills, that's what you learn in school. It's, diagnosing a problem really is done by talking with the person for a good amount of time, especially, like I said, if they're not sure what started the problem. You can usually figure out what's going on with them just by talking. And then your physical exam, where you're maybe moving their neck around or checking out how their elbow functions or checking reflexes or things like that. All of that stuff is just kind of confirmatory to kind of maybe direct you a little bit more clearly in what you were thinking. So does that kind of answer?
Yeah, and I guess it brought up another question for me. As you are talking about diagnostics and working with that person, are you the only one that makes that decision? You're not a team, you're not depending on anybody, it's you and yourself?
Yeah, so most chiropractors are sole business owners. They may have associate doctors underneath, but typically it's just me. So I'm seeing the new patient when they come in. I'm doing the treatment, and I'm following up and making or giving advice from there, I guess. So, yep, just me.
So that judgment piece is really huge in regards to making a decision, sticking with it, making sure it's a sound decision.
Yep. Yep. Absolutely. That's the most important thing is, we don't want to catch, let's say someone comes in with mid back pain. Well, they could have mid back pain from sitting at their computer. They could have mid back pain from a inflamed gallbladder. They could have mid back pain because they've got lung cancer. So it's up to us to kind of decide and do a good physical exam and talk with them about the onset of the problem, um, the timing and how all that works, so we can make a um, good recommendation as far as treatment care. So,
What other soft skills, I would call them, would you say a person would need to be a chiropractor?
you need to be able to talk to people. Like I said, that first 15-20 minutes of just talking through a problem, that's the most important thing. So being able to build a little rapport and then focus on their problem, that's the major thing. So um, there's a lot of other things that have to come along with owning and operating a business then too, if you're going to be in an office by yourself. So um, a lot of that kind of stuff isn't taught in school. So I always recommend to doctors that are starting out, you need to have a very good accountant and you need to talk with that accountant. And you don't need to be embarrassed when you don't understand what's going on as far as business things go, because it's not your deal. You weren't taught it. So it's good to ask a lot of questions of those professionals. So just like you don't try to, well, some people do, but just like you can't just rewire your house all of a sudden without an electrician, you need good advice and good coaching on a lot of the business aspects. So, and in chiropractic, because it's so unique in that most people work independently or own their own business, there's a large number of coaching sort of organizations that pop up to give new chiropractors kind of a head start as far as owning and operating their business. Because if you don't have that kind of head start, or if you don't have that kind of assistance, it's pretty hard to stay in business for very long.
That's good to know. What about education? Do you have as long as of education as an MD doctor, or describe for me that degree?
Yep. So a chiropractic degree, you'll have to have a bachelor's degree first. Um, and then chiropractic school, most of them I think run 10 trimesters. So you go year round, 3 trimesters a year. So it's about 3 years and 3 months. We don't have a residency typically after chiropractic school. You do that your last three terms, where you're still doing some coursework, but then you're also out in the community somewhere under a practicing doctor and learning some skills that way as well. So you do not have to have a bachelor's degree typically to start your chiropractic work, but you have to have it before you finish. So most people will have the bachelor's degree before they start, but there was a program at Northwestern Health Sciences University where I went to school where people could finish all their prerequisites, start the chiropractic course, and then they had a concurrent bachelor's degree course that they would have to finish there at Northwestern too. So it's a lot of extra work. However, it can cut your time down as far as years in school. It can cut that down quite a bit. So yeah, with the programs that they have now, it's as far as the post-secondary and stuff like that, that is just amazing to me, because you can have a lot of college done before you even go get that bachelor's degree, and then you could still finish your bachelor's degree in a couple years and then still go to chiropractic school if that was what you were interested in. So that's a good way to go as far as I'm concerned.
What motivated you to want to be a chiropractic?
So I wanted to do something healthcare related. I didn't really want to be in a hospital, and so my high school had a community apprenticeship program, they called it, something I don't remember exactly, but and I ended up with a chiropractor that had just moved to the town that I lived in, and did my apprenticeship with him for a couple semesters, and thought, hey, I think this is a good way to go. So um, that's the route I went. Not a real great story, but that's the story.
But so you decided right at high school level this was the way you were going to go, and it worked for you.
It did, yeah. The interesting thing about a degree like mine is there's not a lot of lateral, or yeah, there's not a lot of movement. Once you're a chiropractor, you're either a chiropractor or there's not a lot else. So there is research opportunities. There's teaching opportunities as well. But most chiropractors, after they graduate, go into private practice, and that's what they do. And if they leave the chiropractic profession, some will go into, various allied health and wellness kind of fields. I had a couple classmates that graduated and decided that they didn't want to practice as a chiropractor, and they went back to nurse practitioner school, and when are now practicing nurse practitioners. So yeah, once I made the decision and I decided that that's what I was going to do, I just kind of stayed with that. So I was happy with it.
And what keeps you motivated to come in every day and continue doing it? 15 years is a long time, and you've been doing it basically since right out of school. So what keeps you interested?
Well, patients are always interesting. I see a fair number of, I strained my back, or I got a headache today. That's the more majority of the things that we see. But every once in a while, we have a patient come in that no one has been able to help, and if we can figure something out, that's a pretty good feeling to be able to help that person out, live their life a little bit easier, play with their kids, that kind of thing. So that's a good thing. And I've got my own family to take care of too, so I have to keep coming to work. So.
And what would you say, because as you mentioned, people in the chiropractic field tend to own their own business, have their private practice. What would you say is a benefit or a perk to that job, that ability to have that?
To when you own your own?
Yeah.
Well, you've, as far as owning your own, if you're in charge, you get to kind of decide the schedule, and you get to make the decisions and things like that. There's another side to that, though, is if you decide, oh, I'm just going to work one day a week, you're probably not going to have a very good business either. So holding yourself to normal sort of business practices is important, even if you do own your own business. So I work 4 days a week. I work Monday, Wednesday, Thursday, and Friday. Tuesdays I have off. I have, because I've got life too. I got to get other things done, and I typically can't get it done during the work days. So I'm busy most of the time. Fridays I leave a little bit early. I actually teach a kids jiu-jitsu class in Rochester on Friday afternoon, so I have to be out a little bit early for that. So, there's definite perks. If I want to take time off, I just take the time off, try to let people know ahead of time that I'm going to be gone, and you just, there is also there's chiropractors out there that don't own a practice, and they do what's called relief care. So 1 week they may be working in Rochester, 1 week they're working in Minneapolis, 1 week they're working, Duluth, who knows, and they're seeing a chiropractor or seeing patients at another office while someone has to be gone. Also, maternity leaves and things like that, those relief care doctors take over for that kind of stuff. So that's one other avenue of employment, I guess I didn't think of right away, but that's kind of a big deal. I don't like to take a ton of time off, because people, if they're coming in to see me for a problem, we typically need to work on the problem, and I can't just wave them off for 3 weeks while I go to Germany or something. Not that I do that, but you know what I mean. I need to be here if I'm going to be able to take care of people. So.
Right. As a 16, 17-year-old person watching this, and they're thinking that they want to be a chiropractor and maybe go down that road, what high school classes should they consider taking that would really help them and help steer them in that direction?
Basic sciences, anatomy, physiology, biology, chemistry. You need your prerequisites are things like, basic chemistry. To get into chiropractic school, your prerequisites, basic chemistry, typically have to have a couple semesters worth of organic chemistry, um, anatomy, physiology, that kind of stuff. Your bachelor's degree, you can have a bachelor's degree in almost anything, or anything at all, as long as you've got those prerequisites done. So I had a bachelor's degree in exercise and sports science with a minor in community health education. Um, I had a friend in my chiropractic school who had a bachelor's degree in philosophy and religious studies. So he knew that he wasn't going to use that degree at all, and it was something he was interested in. So that's what he finished his degree in, while also getting all the prerequisites done. So typically, chemistry and organic chemistry, those are the hardest classes. So pay good attention in those, ask a lot of questions, you got to study them. There's no calculus or anything, that kind of upper level math involved, but you'll need to know, a little bit of math to do some organic chemistry stuff. So that's the stuff that I would focus on the most. And, do some things you're interested in as well. Your life doesn't have to be in a book studying physiology. So unless you want to be a physiologist.
Yeah, and I guess to wrap up, what would be your final advice for anybody watching this? Because not everyone watching this is going to go down that path, but for anyone watching this and deciding their future, what would be a final word of wisdom you would like to pass on?
My final word of wisdom is if you make the decision to go into healthcare, know that you're going into a field that's going to require a lot of your time, no matter which avenue that you pursue. It's also expensive, and I've had kids ask me, what's something that I wish I'd have known. Those student loans are going to bite you. They're going to come after you. So keep that stuff to an absolute minimum. That's the best you can do, is keep it to a minimum, because you're going to pay on those things a long time. I talk to kids now who are leaving chiropractic school with $250,000 worth of student loans. And it's not just from chiropractic school. They went to a private school before that. They took out the maximum of everything. That's a pretty big burden, and that's something you need to know about. You're leaving school with $250,000. You don't have a job, and no bank's going to let you, start a business with that kind of debt load already. So keep that student loan sort of balance as low as you possibly can.
All right. Well, thank you for your time today, Dr. Klein.
You bet. Glad I could help.